Hello everyone, my name is Emily Cleveland. I'll be walking you through my poster presentation on the effects of age and gender on depression and anxiety measurements across treatment sessions. So jumping into the background information, depression and anxiety are among the most common mental disorders affecting the U.S. today. When individuals seek treatment, they will often have to fill out self-report surveys on the severity of their symptoms, and eventually these surveys will be used to monitor their treatment. The Generalized Anxiety Disorder 7 and the Patient Health Questionnaire 9 are some of the most common used tools in clinics, and they're often used for research. So the PHQ-9 is a 9-item self-report measurement of depression. It is a 4-point Likert scale from 0, meaning not at all, to 3, meaning nearly every day. The score for each item is summed, which then can be used to determine the severity of the depressive symptoms. The GAD-7 is very similar to the PHQ-9. It is just a 7-item survey on anxiety. It has the same 4-point Likert scale and is also summed to determine severity of symptoms. So the PHQ-9 and the GAD-7 have been used clinically as intake forms and to track treatment progress. As intake forms, the sum scores provide information on the severity of the symptoms and also are as a form of detection. So the sum scores traditionally have been used to also track treatment progress by comparing them across sessions, but recent studies have shown that just using the raw scores from the PHQ-9 and the GAD-7 may not accurately measure the symptom change, so that is important to consider. The PHQ-9 and the GAD-7 have also been used to report the prevalence of anxiety and depression symptoms in populations. This especially has been emphasized with COVID-19 studies trying to see how COVID-19 has impacted mental health. These measurements are often used in those studies. So when they report the prevalence or severity of symptoms, they often report it based off of age groups, gender, and other demographics. So while the PHQ-9 and the GAD-7 have shown to be valid and reliable across most demographic groups, some studies have shown that gender and sexual identity can affect the invariance of those measurements, and along with that demographics inherently change the experience of mental illness, it is important to understand how demographics will impact these measurements. So this study aims to determine the effects of demographic factors, gender and age on the PHQ-9 and GAD-7 measurements across treatment sessions, which then goes back to the importance of understanding across treatment sessions due to these being used to track treatment progress. So going into methods, the data analyzed in this study was taken from 2 larger studies. Participants were newly admitted in-person patients above the age of 18. Patients would complete the PHQ-9 or GAD-7 at initial appointments and then again at their 1-month follow-up. The full participant breakdown can be seen in the methods section, but overall, after removing participants that did not complete both sessions and transgender patients, as there was not enough of them to do a full analysis, this resulted in 40 participants for the PHQ-9 analysis and 38 for the GAD-7. The age groups were determined by the median ages for each group or for each data set being around 40, and then the average age of onset for major depressive disorder and generalized anxiety disorder both being around 30. So that resulted in the data being separated into 35 and below and 36 above, and then also by gender, female and male. So the results, repeated measures, split plot factorial design with age and gender as the between subject effects, and PHQ-9 and the GAD-7 within subject effects was completed for each data set. The distribution of participants after separating by age for each study is shown below. So for the PHQ-9, the assumptions were met for sphericity and the insignificant box M's test and significant Bartlett's. The test of the within subjects revealed that there was no significant effect of age and gender on the PHQ-9 scores between sessions. The results can also be seen in the graphs below, with the female line being blue and the male line being orange, and the top graph being under 35 and the bottom graph being over 35. So this just kind of represents the means and the standard deviations of those means for the sum scores. The results for the GAD-7 analysis showed that the same assumptions for the PHQ-9 were met for the GAD-7 test, and the test of within subject effects revealed an effect of age and gender on GAD-7 scores between sessions, and the F value and the P value represent that significance. And then the graphs for the GAD-7 are also shown on the bottom right with the same parameters as a PHQ-9. So overall, there was an interaction of age and gender for the GAT-7 anxiety measures within the sample. And while there was not an interaction with the PHQ-9, the small sample size really limits the strength and validity of these results. So further studies should really use, or could really do, like larger sample sizes and also more sessions to do a further comparison. But overall, future research may test between session measurement variants of the GAT-7 based on age and gender. You can see my references listed below in my conclusion section, and thank you so much for listening, and I hope I can answer any of your questions. Thank you.